Right. We'll have the next speaker, Dr. Himani Prajapati. She'll be speaking on referral patients and initial management of pediatric ocular trauma, a cross-sectional study.
So, good afternoon, everyone. So, pediatric ocular trauma accounts for 30% of eye injuries and 8 to 14% of childhood blindness globally. Despite the advances in the ophthalmic care, delayed or inappropriate referrals and inconsistent initial management can lead to poor outcomes. So, this study analyzes the pattern of referrals, initial management, and prognosis of the trauma, identifying gaps in the treatment protocols and accessibility to the specialized eye care. This will help us to improve the early intervention strategies and optimize outcomes. So this study was conducted at MNG Institute of Ophthalmology, Ahmedabad for 1 year. 0 to 15 years of the cases were included, referred from different facilities like primary healthcare centers or general practitioners or other ophthalmic facilities. Cases with congenital ocular anomalies, pre-existing conditions or incomplete records were excluded. Demographic, clinical and referral details were collected. Clinical assessment was done and assessment of the initial management provided at the referring facility was studied. Informed consent was taken from parents or legal guardians. So my results shows that 100 out of 100 referred cases, 59% were male and 41 were female. 62% were referred from the rural areas and 38% from urban areas. 88% belong to lower socioeconomic class and 12% belong to middle socioeconomic class. As you can see in the graph, most of the injuries occurred at the playground and followed by home, workplace of parents or guardians, and then school. Penetrating injuries comprise of a 68% of the injuries, followed by adnexal and blunt injuries. Different agents were seen in this as a causative agent. So corneal tear was the most common diagnosis, with corneal tear combined with limbal or scleral tear had a higher number in presentation, followed by lid tear and traumatic panophthalmitis. Maximum patients were referred from the ophthalmologist, that is 42%, due to the severity and complications, followed by general practitioners due to inadequate setup like pediatric facilities and general anesthesia facilities, followed by severity in the cases and patients' refusal for the treatment. So 81% of the cases were presented within 3 days, where the majority were due to severity of the cases, followed by inadequate setup. Other reasons were complications and patient refusal for treatment. So main reason for the delay of the presentation was due to multiple consultations, that is 43.24%, and other were inaccessibility to the higher centers and lack of awareness. Out of 100 cases, only 4 cases were given the general urgent surgical management required and was referred due to complications. So my discussion is male predominance was seen consistent with the previous studies, showing boys engaging more frequently in outdoor and high risk activities. Limited access to specialized eye care and lower health awareness in these populations likely contribute to delayed presentation and increased complications. So all the findings underscores the need of urgent awareness programs about safe play environments and household safety measures. So school-related injuries were least common, indicating the relatively safer environment, and the peripheral health centers accounted for 26% of the referral, emphasizing the need of better equipped primary care centers. And lack of parental awareness and financial constraints and inaccessibility to higher medical facilities further contributed to delays. So highlighting the urgent need of for better primary care management, referral systems, and accessibility to the specialist care is needed. So my conclusion is pediatric ocular trauma remains a critical yet neglected issue, especially in the rural and lower income communities. Most of the patients were referred only with the basic treatment without the proper counseling and of the urgency. In reality, many of these patients required specialist care from very beginning, highlighting the significant gap in initial management. Delays in the treatment combined with the inadequate early intervention led to the complications, which could have been avoided with the timely and specialized care. Strengthening the primary health care infrastructure, improving the referral systems, and raising the awareness of among the caregivers can help reduce the burden of preventable blindness. So these are my references. Thank you.
Thank you. You mentioned the age group as 0 to 15 or so.
Yes.
So do you have any idea what kind of injury was the infant getting?
Most of them had wooden particle injuries because
Sorry, what particle?
wooden material, any sort of wooden material.
Infant?
Chip, yes.
Okay.
And one or two cases had also like hook while feeding mothers. Blouse hook was caused the corneal tear also. So.
Right. Ashish,
You've presented the referral patterns, and I would say that any patient who has injury should be dealt urgently unless the injury has been for the last few days. If the patient has an injury on the same day, it is better to operate and even give infections, because your patients had a lot of them had panophthalmitis.
Yes.
So that is a very right thing that you said, that we need to aware our general public and general practitioners, and we need to have certain tertiary care centers who are ready to operate on the same day,
Yes.
thus preventing the infections. So overall, as a cross-sectional study, the referral patterns are nicely said. Then thank you, sir.
Thank you, sir.